As a company, our overall goal is to contribute to the medical industry with our own innovation. We design original surgical instruments as well as improve on others so that these instruments are suitable to the specific patient.
Innovations and advances in biological, medical, and surgical technology are on the rise. Many pre-existing technologies are being made more efficient, durable, and easier to use. Our task was to design surgical instruments to aid in the kidney transplant from a cadaver frog to a live recipient frog.
We will be performing a double kidney transplant in order to work with the vena cava in the dorsal aorta instead of the renal arteries, which is significantly larger and easier to work with.
The needle's main function is to dispense the adhesive sulfocurate to attach the blood vessel together. The needle itself will attach on to a normal syringe. It provides easy accessibility to blood vessels, especially when these vessels are hidden under the spine of the frog, and comfort to the user so that they do not need to articulate their hand in complex positions where fatigue can be caused. It will be made out of stainless steel, which is the standard material for most medical instruments.
The clamp's main function is to stop blood flow in the living frog in order to limit blood loss and possible blood clotting. It is designed in a way so that when one pushes from the handles, the opposite side opens, which will clamp the blood vessels. It would be made out of Hytrel D50, a form of polymer from DuPont, which is durable and flexible, suitable for our device. An important aspect of this design is that it is disposable, so it will not need to be reused after surgery, and will be relatively cheap to produce and buy.
Major problem was manipulating around the internals of the frog to reveal the kidneys. So this retractor was designed to solve that problem. It consists of two handles attached to a pivoting point, and as these handles come together, the probes at the end of the device move apart, thus providing the function of expanding the surgical area. If the retractor had a lock and if it was left to rest on the frog, it may pull on organs, causing damage. That's why it's different from other retractors. This instrument is made out of stainless steel, which is durable, corrosion-proof, and can be reused many times without being affected by sterilization.
This device is designed to slide onto tweezers, hence the name, and hold the kidneys in place and move them from the cadaver to the patient. They are slightly curved and made from the same material as the clamp, to allow the kidneys to fit in easily and to prevent any damage to them. These will also be disposable, having a low production and retail price as well.
With the use of all our devices, the process of kidney transplant becomes quite simple with a systematic approach. Problems related to size, blood flow, and surrounding organs will be eliminated. Working together, our devices will get the job done.